Hi, this is Travis here at Exercise Lab with another video for you guys. So I'm a doctor of physical therapy for those who don't know me, and I'd like to talk to you guys today about a topic I spend a fair amount of my time talking to other patients about, which is balance and then falls. And so what do we mean by balance? What are we saying? We say it's good or bad. And then the other side of that, falls. And we know obviously falls are a huge problem. And so how do we minimize them? And people who've already had them, how do we prevent them from happening? Hopefully, ideally in the first place. We certainly know that when you've already had a fall, that's a great predictor of future falls, and that does create somewhat of a downward spiral. So we want to try to intervene on that as early as we can and try and do all the things we're able to. And so what's the literature telling us about how we can do that? What's my own 2 cents on that and all that good stuff. So if you're interested in learning a little bit more about what you can do about falls and how you can improve your balance, go ahead and stay tuned and we'll get started. All right, so I don't want to get too deep into the weeds on this, but I want to just briefly define balance. And so balance is effectively my ability to keep my body controlled either statically or dynamically. And so we kind of have two main camps when we think about balance. Static being, can I stay just glued in place? A good example would be, can I stand on my feet together? Can I stand on one leg? That's effectively, can I just maintain my position? And dynamic balance would be, can I move in a controlled manner without losing my balance? And so I might be widening and moving my base of support and then seeing if I can still control, that movement. And so those things are essentially static and dynamic balance. But what gives us those abilities are a couple of different systems. And so again, I don't want to delve too deeply in this, but certainly any of you can read about it. And maybe at some point I will touch on it a little more deeply. But our visual system is part of what gives us balance. And so, as people get older, they tend to become a little more visually reliant because the other systems decline. And so our eyes decline as well. But one of the things that happens is if it's dark or dimly lit, people tend to have more issues with their balance. If you close your eyes, somebody might feel like they don't have very good balance. And so that sort of tells us that our visual system is part of what gives us balance. Another system which lives inside of our inner ear is known as our vestibular system. And for anyone who's had vertigo, you can probably speak to the fact that it can be a very disorienting experience. People feel like the room's spinning and they're going to vomit. And that's because we have these little basically salt crystals that sort of help us, perceive where, horizontal is and keep us kind of perpendicular against gravity. And they help us to kind of orient ourselves in space. And so the vestibular system is part of what gives us balance. And then the last one is sometimes referred to as our somatosensory system, having sensation, having a motor control system that sort of gives, responds to the environment and allows me to move, purposefully in space. And so when you combine those three things together, we sort of have a collection of what we would call balance. And so again, static being half of that and then dynamic being another part. I don't know that I actually would say half now that I think about it, but it's certainly static is a piece of it, dynamic is a piece of it. I think a place that's nice to intervene sometimes for somebody who's having some bigger balance issues can be starting on static. Dynamic tends to be a little more challenging, a little bit more higher level. And so in this video, I'm actually going to cover a little more static balance. I'm going to maybe touch on a little bit of dynamic, but perhaps in another video, I'll cover more of the dynamic stuff, which actually ends up looking almost more like agility. So this is going to be a little more of a somewhat low level, but not terribly low level balance video focusing more on static balance. All right, so as I kind of alluded to a moment ago, static balance, you can test very simply in a doctor's office with a test called a Romberg test. Can you stand with your feet together and can you hold that for about 30 seconds? If you can do that, great. Close your eyes. Can you hold that for 30 seconds? Okay, good. If you did that, you'd basically pass what's known as a Romberg test. We don't tend to use that test very much anymore. It's a very simple screen. But certainly if you have issues in that bucket, that would suggest, you want to try to intervene on your static balance. There's another progression to that known as a sharpened Romberg, which is can you come into tandem stance, feet kind of like in a train track position. And then can I maintain that for 30 seconds? Okay, good. Can I close my eyes 30 seconds? Can I still stay there? Okay, good. And then that's the sharpened Romberg test. They tend to use them a little more as a screen. It's just a quick and dirty assessment. There are more sophisticated ways to look at balance. A Berg Balance test is a little bit better test, kind of capturing more static balance, but some dynamic. And there's another test called an FGA, which is a little more dynamic. And so those are kind of some of the more baseline assessments for balance. So for those of you who are looking to assess balance in somebody who has issues there, go ahead and check out those tests. There are limitations to those tests, though, and sometimes you can have somebody who has a fairly high score who maybe still has some issues or they might still fall down. So they're definitely not the end-all be-all, but they are validated, and so they're decent tests all considered. And if you've had falls in the past, you already know you're at a fall risk, so you don't necessarily have to do that test to tell you that. But at the same time, you can kind of see where you fall within it. You can see if you're a high fall risk or you're moderate or you're mild, and you can kind of go from there. I would say in this video, I'm going to show some things that'll kind of be applicable to somebody probably more in that moderate to maybe-ish, high-ish fall risk. The milder ones, some of these things might be a little bit easier, but they might still challenge some of you. So if somebody does have issues with those simple little Romberg tests, that can be an easy place to start. Just, okay, stand with your feet together. And there's nothing particularly exciting about that, but that's something that you'd want to try to have somebody get better at if they're having difficulty there. From there, you can have somebody stand again with their feet maybe not right together, but pretty close, and then just do something very basic like a heel raise, okay? And that actually can be a little bit harder than it looks for many people who have balance issues. Can you just control it at a fairly deliberate pace? I'm not going, real quick here. I'm also not necessarily encouraging a prolonged pause, although you can. Sometimes I'll just tell people to start out almost a little more dynamically, and then maybe on the last repetition when they're getting some fatigue, just go ahead and try and hold it. And so a good old static heel raise is actually a pretty good test because, you have to be able to control your hip stability. Sometimes people who have weak glutes, they'll kind of shoot their hips forward on this one. And so, you'll see them. You want to basically keep your body stacked and then just lift those heels up and down. And a progression there would be to elevate your feet on something. So, if you have a little block or a little towel and just kind of go up and down there. Calves are pretty big players when it comes to walking as well. And one of the first strategies that we use to keep our balance is what's known as the ankle strategy. If somebody's not at a level yet where they can do that, you can have them just come in here, hold on to a countertop, hold on to a large, ottoman, something that's just not going to move on them. And so that can be a pretty simple way to just work on a basic heel raise. All right, and so after those heel raises, a simple way to see if they can control just a good old-fashioned step forward and then back, okay? And so what I like to do sometimes is just see if they can kind of exaggerate that heel to toe. And so what I ask them to do is just kind of roll onto their foot and then just kind of roll almost off of it, okay? And so a simple way to do it initially, again, depending on how shaky someone is, obviously you can have them maybe holding on to something, if they need it. Ideally, you want to encourage them to not hold on to things, but certainly you don't want them to fall down working on their balance. So if somebody needs to do this, and that's a fine place to start. And you can start with a small step, that's fine. You just want a little bit of weight shifting. So in some ways this is dynamic, but it's also kind of static because you're not really moving that much. You're definitely not moving very briskly. And so you can just try to move here, and then from there you can just make it a little bit larger, and then you can almost make it into like a little bit of a lunge, okay? So you can try and do it like that. And then sometimes to make that a little harder, what I'll tell them to do is just keep that foot kind of anchored and then just shift back and forth, okay? And so I'm basically just kind of rocking without completely picking up my feet, front to back. And that ends up making the exercise a little more challenging, I would say, than when you actually plant and push off. But sometimes it can be dependent on the individual. And then certainly they can do the other side. And then, anytime there's an imbalance on one side to the other, as I've spoken about in other videos, you want to try to emphasize the sides a little harder. So somebody has maybe an old stroke, they have a little more weakness in that left side, and it's harder for them to do this side. I would have them spend a little more time on that side and in that direction on that particular movement. Now from there, if you're trying to do that stepping maneuver, you can see if they can come over and just pick up that back foot a little bit, okay? And then they're basically working on a little bit of single leg balance as they come in here, okay? And that can be a simple one to just try and work on having them stand on one leg if they're not at a point yet where they're really able to. So if you ask them to come up here and they're not really able to do it, here they're just kind of testing the waters, they're just kind of shifting their weight over, and then they're just seeing if they can maybe pick up that back foot for a little while, just to give them some of that single leg balance. Now, certainly you could just bring them over to a place they can hold on to something and maybe ask them to just be light on the fingertips or only hold on as much as they need it, and then hopefully pull back on those fingertips once they're there. There's a couple of different ways you can tease that out. But one of the things I like to do when I get them doing that movement pattern of picking up that back leg a little bit is then at that point, you see if they can just kind of hold it for a count, okay? Or lean forward a little bit and then come back, okay? And so what that ends up doing is they're shifting their weight, and then they're also moving in that position to get a little bit of almost like what we call kind of like a cherry picker kind of maneuver. And so a forward reach is another test of balance, is just, how far forward can somebody reach. And so what this ends up doing is this brings us into a little more of a forward reach almost, with one leg at a time. And so, I'm just basically trying to move somebody into that direction. And so a pretty cool progression would be to eventually have that person be able to come over and then just do a good old-fashioned forward reach. And, again, you could just eventually have them do something like this, okay? And again, I could have them in front of something that they can hold on to and maybe just tap. And so You can decide where you want to have them tap to. In the beginning, you might just have them move, only an inch or two in this direction, and that'd be fine to do that. But eventually in time, hopefully they're starting to, get a little bit more. And almost like this was a tail, that hind leg, when it kind of goes farther back, that actually kind of works as a counterbalance. Sometimes it can actually be harder to do this if you were to keep your leg right next to you. But I don't really care about that so much. I think it just feels more natural and it feels better when you let that, rear leg lift. And so sometimes I'll let people do that. And so just to recap on all that, what I'll sometimes tend to do first is, again, just a large sort of exaggerated step. From there, you can kind of turn that into almost a little bit of a, lunge type maneuver where I'm not necessarily going, all the way into a lunge, but I might, depending on, where that person is balance-wise. But I'm just basically doing the very beginning of it. And then from there, I would just maybe, again, see if that person's ready to just do a little bit of this sort of anchored front to back shifting. And then from there, shift forward. See if you can just pick up the back leg for a time, a short count. And then pick up that back leg with a little bit of a forward trunk before you come back down, okay? And then again, or just tease out just that part itself, or just, have them do almost like a single leg deadlift. And that would be, a little bit of a harder thing for somebody to do, particularly who has balance problems. My guess would be if somebody can do this pretty well, if someone's able to do a maneuver like this, good chance their static balance is not too bad. All right, so I don't think that person's going to be a very high risk of falls. That isn't part of the battery of those balance assessments, but it certainly requires a lot of single leg stability, a lot of good hip control stability. Certainly also the trunk pulls a lot of pieces together, and that is a pretty difficult thing to master. So that's something you can add into somebody's repertoire balance exercises. All right, so something else that patients get asked a lot when they go in to see a neurologist is, can you, effectively walk a tightrope? Can you do that good old sobriety checkpoint test, right? And so for many people, that is a pretty hard item to do. Forward and then certainly backward is a more difficult one. So I wouldn't usually start there. But what I could do for somebody is maybe have them start with just a good old-fashioned heel to toe tap, okay? And so if I want to work somebody's static balance, can you freeze your body in place and just bring that heel around for a little touch on the toe? It works on a little coordination because I have to be able to bring my leg over to a target. And then statically, I've got to be able to keep myself, in position. Once that starts to look easy, then I can turn that into a little bit of a plant with a shift. And so it's almost like step one of that tightrope. And so I can just see, are you able to alternate this in place? Once again, you want to try to pull back those hands as soon as somebody's ready, because unfortunately, you really do have to provoke somebody's system to get better at balance. If you're always kind of holding on to things, it's definitely more difficult to get better at balance. I want to make sure I hammer home is I don't want anybody to fall down trying to work on this stuff. On the other side of that, though, if you're working on this stuff on your own and you're always holding on, see if you can create an environment that makes it a little bit safer. And so sometimes you can stand in the corner, so you have kind of your buttress kind of between the two walls, and maybe you could do this so at least you kind of have something to fall into. You could even put a chair in front of you sometimes to make sure, so if I had a sturdy chair in front of me and I'm kind of back in the corner here, I've got a pretty good little, zone of I can reach for things to kind of steady myself. So it's always good to have close things within reach when you're trying to work on balance, just in case you do moving outside that base of support a little too far and you end up not, falling over. So obviously we don't want that to happen. But back to these plant shifts. So once somebody's at a level where they can do this pretty well, then it's not really a big jump to say, okay, let's go ahead and just put that other foot in front now and just take it down, okay? And then at that point, they're doing, effectively the sobriety checkpoint or the tightrope. You can technically say that's dynamic, but it's also kind of static because you're moving very deliberately, very slowly, and you're almost trying to keep yourself kind of glued in place, even though, as you're moving forward. So that one's a little bit of an in-between, but I would still kind of consider it a little more in that static category. But, once you're at a point you can do this tightrope walk fairly effectively, risk is going to be minimized. All right, so something you'll see people who have poor static balance and also who have just kind of poor hip and thigh strength is they tend to plop back into their chair a lot. So a really simple thing you can ask them to do is just try to sit to stand without using the armrests if they can. And, again, depending on how difficult this is, initially they may need to use those armrests and may need to put their hands on something or perhaps even their legs. But, if somebody can, you want to try at least maybe see if they can control the descent and then maybe use armrests on the way up. At least that way they're getting a little bit more of that eccentric challenge. But eventually you'd like to try to see if you can get that person to maybe just do something where they're doing just kind of a nice little sit to stand. And then obviously a progression from that would be to just do, a good old fashioned air squat. But many times, working on a little bit of strength and working on balance in one shot can be a great way to go, particularly if somebody doesn't have a lot of endurance, right? Because you don't always have the luxury of being able to throw, tons of exercises at them. Sometimes you have to only, pick your battles, and you have to be able to pick those exercises that allow you to kind of get a couple of different camps. And so if I can marry together a little bit of strengthening with some balance in one shot, I think that's generally always a pretty good way to go. And I think the sit to stand, which is effectively a squat, checks many boxes off the list. And so this one's definitely a keeper. Obviously, if somebody has knee issues and things of that nature, sometimes you have to get a little creative in the way you might have them do that. But generally speaking, if they can do this exercise, I think it's a pretty effective one. All right, so for one of the last things I want to throw at you guys today, this is going to be a little more in that dynamic category, but seeing if somebody can just move and control kind of a 1-2 little forward step can be an easy way to just get somebody moving a little bit outside, creating a new base of support, and then I can also have them move either laterally or even diagonally, okay? And so sometimes what I might have somebody do, and I think agility ladders can be great if you have one of those. Sometimes you can just tape some lines on the ground and just kind of have somebody work a 1-2, 1-2 side to side, 1-2 diagonal, and you can even call them out. And sometimes it's nice to call them out in a way that they can't exactly anticipate. So, rather than just telling the person, okay, just go forward and then just go back, you can say, I'm going to give you a few different commands. I'm going to say forward, then I'm going to say back, or I'm going to say forward, then I'm going to say diagonal, and so that person has to move, and you can let them pick a little bit, but, basically you want to make it just a little bit random, so you're kind of keeping them guessing a little bit. And that's a really cool layer to put on to dynamic balance, is when you sort of do random call outs, and there's tons of ways you can do that, but it works on a little more of what we call reactive than anticipatory balance. It's a little different if I know something's coming, right? If I know someone's going to try to push me down, I'm going to ready myself for that. Versus if somebody just comes and pushes me, I have to just see how I respond. And hopefully I'm going to respond in a way that's going to, allow me to maintain my balance. And so that's a nice piece to get into with dynamic balance. And so I probably will upload another video at some point, hopefully in the near future, and I'll speak to more dynamic balance ideas, but I want to just kind of throw that out there for now. Something else that's, pretty popular in static balance categories, I should say, is unstable surfaces. This is an Eric's pad. Bosu balls are there. There's tons of these things, and Eric's was one of the first players in the game, but there's a lot of manufacturers of these things now. Most of them are probably more alike than different, so I wouldn't necessarily say you have to splurge on an Eric's pad. You can get a lot of different ones. I actually use this thing more as a knee pad for a lot of exercises now, because unfortunately the literature has not really shown that unstable surface training makes a huge difference on a stable surface or on land. So there's a pesky little principle called specificity, which basically tells us you get better at what you do. So if you want to get stronger, you got to work on strength. If you want to get, better endurance, you work on endurance. And if you want to get better with your balance, and you want to get better on your balance on land, you got to do more land-based training. Unstable surface training maybe gets a little bit of carryover. Certainly it's better than doing nothing at all, but you're probably not going to get as much bang for your buck doing a lot of training on unstable surfaces. So they're very popular in PT settings. They're even popular in gym settings these days. So, you can pepper in the routine a little bit with some unstable surface training, but I don't think it's going to be the end all be all. I think you're going to get more bang for your buck doing more challenging things on land. And I think the things in this video can hopefully be a good start. One thing I wanted to leave you guys with today is that sometimes just getting stronger by itself can actually make an improvement in balance. So sometimes that can even be a first line for somebody who has just a mild balance problem, but I identify that person has a little bit of weakness in their thighs and hips. I just try to get that person's legs stronger. And sometimes I don't even have to touch balance. And there was a study that was done, I don't even remember who, but they took some older seniors and put them through a seated strengthening program, and just different stations. I think it was just kind of general strengthening. It was full body. It wasn't necessarily even just lower body only. And it reduced their falls by like 35%. And really the punchline was, all we did is get those people stronger. It wasn't like we were actually worked on balance specifically. So strengthening is definitely an underutilized avenue for balance work. I see people working on balance all the time in therapy offices, and strengthening kind of maybe they're touching on it, but they're not working on it nearly enough. So strengthening is going to be a big one. These exercises, I think, in addition to some of that stuff, can definitely make a little bit of a difference as well. And so for those of you who are familiar with this channel, probably know it's rarely only one thing. Oftentimes you got to marry a few different things together. Quite frankly, I don't think it's a bad idea to even throw some endurance work at somebody who has balance issues, because fatigue can certainly play into balance problems, right? If someone's tired, it makes them step a little funny. Maybe they're more likely to catch their toe on something, and then all of a sudden they fall down. So, that would probably be not my first go-to though, but it just speaks to the fact that, I think sometimes you do have to come at this from a few different angles. So direct balance work only being really one arm of it. general fitness is going to be another piece. And so again, it speaks to that whole idea of longevity. Get yourself ready for those last years of your life, because the more strength you can have going into them, hopefully the more you can weather those storms that are likely going to come your way. And certainly a fall where you're going to break your hip is one of them. And again, many people never really get out of those holes, right? And those things just keep kind of coming and coming. And obviously, if you never really got that strength back, well, guess what? You're still going to be at a fall risk. And not only that, you're probably at a higher fall risk now. And so then down you go again. And, again, it's just one of those downward spirals. So the more gusto you can get somebody, the more you can just kind of get them conditioned and strong. I think that's an underutilized aspect of balance work. And so hopefully I've made that clear. Now, the other thing I wanted to mention, though, is that the best predictor we have for falls is when you've already had one, because people just never regain that initial level they had. They fell down, they broke something, or they just fell down, and they don't really do anything differently, and so they never really fortify themselves against those future falls. So I definitely want to intervene right away. I want to get that person stronger. I want to get them more fit, and I want to even maybe throw in some balance work because none of those things tend to get better overnight. And so I just want to try to hit that person from all those different angles. Obviously, also, if they're not, consuming enough protein, you got to have them do that even. So even nutritionally, there are things you can do to probably improve somebody's balance, because I got to put more muscle mass on somebody who's frail and maybe doesn't have, much muscle mass to begin with. And so that's also something you should keep in your back pocket. So once again, I wanted to try to make this video a little brief. At some point, I might do more of a discussion style video where I'll delve into some of those concepts a little bit more, but I wanted to have this video be kind of more of a demonstration-ish video with some discussion points. But if you guys like this today, I'll definitely try and throw a longer talk at you. So go ahead and let me know. As always, subscribe if you like this stuff, and I hope you have some fun.